What happens when you quit smoking? After 8 hours of not smoking, within 8 hours, your carbon monoxide levels will return to a more normal level. Carbon monoxide is a chemical present in cigarette smoke that replaces oxygen particles in the blood, lowering the amount of oxygen your tissues receive. When carbon monoxide goes away, your oxygen levels start to increase to more normal levels. This increased oxygen helps nourish tissues and blood vessels that were getting less oxygen while you were smoking. After 24 hours of not smoking, by the 1-day mark, the nicotine level in your blood drops to a negligible amount. By then, reduced constriction of veins and arteries and an increase in the oxygen levels that go to the heart help boost the functioning of your heart. This decreases your chance of getting a heart attack. After 48 hours of not smoking, previously damaged nerve endings start to regrow. You may also start to notice that senses that were previously dulled due to smoking improve. You may realize you're smelling and tasting things better than you were before. After 72 hours of not smoking, within 3 days you'll often find yourself breathing more easily. This is because the bronchial tubes inside the lungs have started to relax and open up more. This makes air exchange between carbon dioxide and oxygen easier. After 7 days of not smoking, the carbon monoxide in your blood drops to normal levels. Remember, the chances of quitting smoking for good increase with every attempt. If you can make it to 1 week, you can make it for a lifetime. After 2 weeks of not smoking, you may start to notice you're not only breathing easier, you're also walking easier. This is thanks to improved circulation and oxygenation. Your lung function also increases as much as 30% about 2 weeks after stopping smoking, according to the American Lung Association. After a month of not smoking, in just 1 short month, you can experience many health changes related to stopping smoking. One is feeling a sense of heightened overall energy. You may also notice that many smoking-related symptoms have decreased, such as sinus congestion and shortness of breath with exercise. In addition to these benefits, fibers in the lungs that help keep the lungs healthy are growing back. These fibers can help reduce excess mucus buildup and protect against bacterial infections. Finally, those who make it for 1 month without smoking are 5 times more likely to quit for good. After 3 months of not smoking. Within 3 months after quitting, a woman can improve her fertility, as well as reduce the risk that her baby will be born prematurely. After 3 years of not smoking, your chance of heart disease drops by half. Not only limits oxygen flow to the heart, it also damages the lining of the arteries. Fatty tissue starts to build up, making it more likely that a person will experience a heart attack or stroke. Quitting smoking can help reverse these effects and promote a healthier heart in the years to come. After 10 years of not smoking, at the decade mark, the chance of getting lung cancer drops by half. In addition to decreasing the chance of lung cancer, your risk of developing smoking-related illnesses also goes down. This includes a reduced chance for cancers of the mouth, esophagus, bladder, kidneys, pancreas. After 15 years of not smoking, at the 15-year mark, your chance of a heart attack decreases to equal that of a person who's never smoked. While it can take time to turn back the clock on the effects of smoking, having 15 smoke-free years represents a major milestone for your health and overall well-being.